Hello, this curriculum summary presentation is by Hui Lee and Natalie Alfaro Perez. Our curriculum, Sex Ed, You Can Too, is on STD and HIV prevention education among high school students. This curriculum was developed because new estimates show that there are about 20 million new sexually transmitted infections in the United States each year. 50% of all new STDs are from people of the ages of 15 through 24. Research proves that STD and HIV prevention education can delay the onset of sexual activity and encourages youth to engage in safer sex among those students who are currently sexually active. The goal for the curriculum is to increase high school students' knowledge and promote safe behavior that will prevent the transmission of STDs and HIV. The curriculum Sex Ed, You Can Too, has a theoretical foundation of the health belief model, theory of planned behavior, and social cognitive theory. The theories allow that the curriculum developers attempt to explain high school students' health-related behavior. The health belief model identifies that people are most likely to perform the desired behavior if they feel they are at risk for a certain condition. With the theory of planned behavior, we look at behavioral attitudes and how that can affect the way students think, subjective norms, which is what students perceive as important, and perceived behavioral control, which is the extent of ease or difficulty in which we believe we can perform a behavior. Lastly, with a social cognitive theory, we measure the outcome expectations of high school students and how they are directly related to their social interactions, experiences, and media influences. Session 1 is on STD education. This first session will include the introduction to STD education and encourage students to think about their beliefs and community standards and norms of sex and STDs. The session will involve small group discussion to explore issues and critically think within peers. Session 2 will include the introduction to HIV education. It will encourage students to think about their beliefs and community standards and norms of HIV. There will be an introduction group discussion to raise questions about HIV and how to break the stigma. In creative play, students will be able to role play to practice safe techniques of how to openly discuss HIV facts and concerns with family, friends, and partners. Session 3, You Can Too, will focus on applying knowledge into practice. The goal is to help students gain self-efficacy. The curriculum can bring discomfort to some students, whether it be because of embarrassment or personal beliefs. This session invites students to role play through class activities. This includes participating in verbal scenarios, following instructions in handouts, or teach-back activities. These are based on the comfort level of the students. Lastly, the session includes personal reflection of the content. The curriculum aims to bring a learning environment that is based on equality and is safe and respectful for all students. This curriculum can help teens adopt lifelong behaviors and attitudes that support behaviors that reduce their risk for sexually transmitted diseases and HIV. That concludes our presentation, and thank you for your time.